A seemingly benign visit to a healthcare center in the heart of Liberty County, Texas, would soon unfold into a chilling tale of medical malpractice. In the early days of March 2018, Lisa Marshall, a vibrant woman in the prime of her life, discovered an unusual lump in her breast. Alarmed yet hopeful, she sought medical help, placing her trust in the healthcare system. She walked into the office of Nancy Thompson, a well-regarded nurse practitioner in the community, hoping for reassurance and guidance. This consultation marked the beginning of a professional relationship, binding by a duty of care owed by Nancy to Lisa. It is the cornerstone of medical practice, the invisible contract that reassures patients that their health and well-being are in capable hands. This is the first criterion for medical malpractice, a professional duty owed to the patient. Nancy, with her years of experience, examined Lisa and listened to her concerns. She assured Lisa that the lump was benign, a harmless anomaly that posed no threat. A sigh of relief escaped Lisa's lips, her worry lines softened, and she trusted Nancy's judgment, leaving the clinic with a lighter heart. However, the duty of care extends beyond initial reassurances. It encompasses the responsibility to exhaust all possible avenues of investigation, especially when a patient presents with a symptom as significant as a breast lump. While Nancy's verdict of a benign lump was based on her expertise, it is standard practice to conduct further tests and imaging to confirm such a diagnosis. This step was missing in Lisa's case. In the world of medicine, where every second counts, this overlooked step was a ticking time bomb. Lisa continued her life, unaware of the threat that lurked beneath the surface, growing with each passing day. Her faith in Nancy's diagnosis was unwavering, her trust unbroken. A simple test could have changed everything, but little did Lisa know that her trust was misplaced. In the face of uncertainty, Lisa returned to Nancy, hoping for reassurance. She had found an unfamiliar lump in her breast and was concerned, as any person would be. It was still March of 2018 when she made her second visit to Nancy, a trusted medical professional, carrying her fears and worries like a heavy load. She was hoping that Nancy, with her expertise and experience, would understand her concerns and take them seriously. She was hoping for a thorough investigation, for the certainty that everything was all right, or at least, a comprehensive plan if it wasn't. But what she encountered was a dismissive attitude. As Lisa poured her fears out to Nancy, the nurse practitioner assured her again that the lump was benign. No need for alarm, no need for further testing or imaging. Just like that, Lisa's concerns were swept under the carpet, her plea unheard. But let's pause here. Let's reflect on the gravity of this situation. You see, this wasn't just about dismissing a patient's concerns, this was a breach of professional duty. A medical professional's job is to listen, to understand, and most importantly, to investigate. It was Nancy's duty to order further testing, to ensure beyond a shadow of a doubt that Lisa was in the clear, but she failed to do so. In this neglect, we see a stark parallel to the second criterion for medical malpractice, the breach of such duty. When a patient's well-being is at stake, there should be no room for assumptions or dismissals. Every concern should be taken seriously, every anomaly should be thoroughly investigated. But for Lisa, this was not the case. Her plea fell on deaf ears, her concerns were dismissed, and she was sent home with a reassurance that would later prove to be devastatingly misplaced. The clock was ticking, and with each passing day, the unseen threat within Lisa was growing. And all the while, Lisa was left in the dark, her plea unheard, her fears unaddressed, and her life hanging in the balance. 9 months later, Lisa's world came crashing down. The routine of life was abruptly interrupted by a chilling discovery. Lisa's breast cancer, once a silent and unseen threat, had evolved into an aggressive beast, spreading its venomous tentacles to her lymph nodes. This wasn't just a simple case of breast cancer. No, this was a voracious, relentless entity that had been given time to grow and establish its ruthless reign within her body. The medical term for this condition is metastatic breast cancer, a form of the disease that has spread beyond the breast and into other parts of the body. In Lisa's case, the lymph nodes. This was a dire situation. Lisa's cancer was no longer a localized problem that could be quickly addressed, but a systemic issue, a ticking time bomb, threatening to detonate at any moment. The once possible treatment option of a lumpectomy, a surgery that removes only the tumor and a small amount of surrounding tissue, was now off the table. The cancer had progressed too far, too fast. It had taken over her body, leaving no other option but the most drastic one, a bilateral mastectomy. This is a surgery that involves the removal of both breasts, a physically and emotionally scarring procedure that no woman should ever have to face. Following the mastectomy, Lisa was subjected to the harsh reality of chemotherapy, a treatment as punishing to the body as the cancer it fights against. The potent drugs coursed through her veins, attacking the cancer cells but also causing debilitating side effects. This devastating medical condition, this injury, was the direct result of a breach in professional duty. A nurse practitioner who should have sent Lisa for further testing when she first discovered the lump, did not. This is the third criterion of medical malpractice, the injury caused by the breach. Had the diagnosis come sooner, Lisa would have only needed a lumpectomy, but now she was fighting for her life. The consequences of the nurse practitioner's negligence were now painfully clear as Lisa faced the fight of her life. The negligence of one had led to the suffering of another. Lisa's world, once vibrant and full, was now shrouded in the shadow of irreversible consequences. The delayed diagnosis, the misstep of a healthcare professional, had set into motion a chain of events that would leave her life forever changed. A professional duty was owed to Lisa, but that duty was breached. Her trust in the medical system was shattered, her health severely compromised. The failure to diagnose her condition in its early stages had given the cancer time to grow, to spread. The breast cancer, initially controllable, had metastasized to her lymph nodes. The physical toll was immense. A bilateral mastectomy was performed, removing both breasts in an attempt to halt the cancer's relentless march. The surgery, invasive and aggressive, left her with deep, raw scars, a stark reminder of the battle being waged within her body. The pain was unbearable, a constant torment. Following the surgery, chemotherapy was administered. The potent drugs coursed through her veins, their purpose to kill the cancer cells. But they also wreaked havoc on her body. Her hair fell out in clumps, her skin turned sallow, and she was plagued by ceaseless nausea and fatigue. She watched as her body, once familiar and comforting, became a stranger to her. But the physical suffering was only part of the story. The emotional and psychological trauma ran deep. Fear and uncertainty became her constant companions. Every ache, every pain, was a reminder of her mortality, of the cancer that threatened to steal her life away. The financial burden added to her stress. Medical bills piled high, a mountain of debt that seemed insurmountable. The fourth criterion for medical malpractice, the resulting damages, was met in full. The negligence of a healthcare professional had led to immense physical, emotional, and financial suffering. Lisa's life was forever altered, her future uncertain. Lisa's life was forever altered by a mistake that should never have been made. The unbearable consequences of medical negligence were a stark reminder of the duty healthcare professionals owe to their patients, and the devastating impact when that duty is breached. In the courtroom, justice was waiting to be served. The air was thick with anticipation as the jury filed back into the room, their faces unreadable. The fate of Lisa Morrison hung in the balance. The courtroom was silent, save for the steady ticking of the clock on the wall. Lisa, a resident of Liberty County, Texas, had been the victim of a grave medical oversight. 2 years prior, she had visited a nurse practitioner, complaining of a lump in her breast. Despite her repeated visits and persistent pleas, she was told it was benign, and no further tests were ordered. 9 months later, she was diagnosed with an aggressive form of breast cancer that had spread to her lymph nodes. The negligent delay in diagnosis had cost Lisa dearly. She had to undergo a bilateral mastectomy, followed by grueling rounds of chemotherapy. The once vibrant woman was reduced to a shadow of her former self, her life turned upside down. The disease had not only invaded her body but also her life, robbing her of her peace and happiness. The nurse practitioner had a professional duty to Lisa, a duty he failed to uphold. The breach was clear, and the injury painfully evident. The aggressive breast cancer, the surgical scars, and the emotional trauma were all injuries caused by this breach. And the damages? They were devastatingly real and horribly tangible. The jury had been presented with these facts, the evidence of negligence, the clear breach of duty, the resulting injury, and the catastrophic damages. It was now time for their verdict. After what seemed like an eternity, the jury foreman rose, clearing his throat. The courtroom held its breath. We, the jury, find the defendant guilty of medical negligence. We award Lisa Morrison $18 million in damages. Gasps echoed around the courtroom. It was the largest verdict ever awarded in Liberty County. The magnitude of the verdict sent shockwaves through the courtroom and beyond. The verdict stands as a stark reminder that when someone suffers due to medical malpractice, the law ensures they receive full and just compensation.